I've represented a number of victims of scarring, and in showing scarring, I would ask you to keep in mind two things, P's. The first P is pictures, obviously, and pictures both acutely, that is at the time the scar was sustained, and pictures several months down the road are very important, obviously, in establishing a scarring case. The second P is the prognostication, and that would come from an expert. In a scarring case, like virtually every personal injury case, you need medical experts to establish things like causality, prognosis, and impairment. In a scarring case, we certainly want to determine if the scar is permanent. We also want to determine if the scar is permanent, will it get better in time? What is the time in which we will know what the medical end result is? And in that sense, it perhaps is not all that different from many other personal injury cases. And you want medical opinions as to whether the scar has, quote, matured, such that we know how it will look down the road. And we also want to inquire whether certain procedures, perhaps surgical in nature, will improve the condition of the scar. If the answer to that is yes, then we want to know what the cost is of the surgeon's fee, as well as anesthesia fees and hospital fees. So I guess I would say to you that scarring is really like any other injury, except the pictures take on an even greater importance, of course. But in terms of prognostication, in non-scarring cases, we often ask about the maximum medical result, or what is the end result. And in scarring, we'll ask, well, has the scar matured? And then we'll know exactly how the scar will look in the future. And of course, it is up to the medical expert to tell us what can be done to improve the condition of the scar. So I would say and conclude that a scarring case needs a thorough and careful exploration of these issues. Thank you.